Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Breckner, Vice President at R3, and each episode, I sit down with our founder and CEO, Dr. David Greene, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine. All right, we are here today with Dr. David Greene. My name is Samantha. Thank you to all of our listeners for listening to our pilot episode. To kick it off, we're going to talk today about what are stem cells and what are exosomes. Dr. Greene, would you mind enlightening us?
Well, thanks for having me. I'm assuming I'll be a frequent contributor to this podcast.
We hope so.
All right, so we're going to start with the basics. What are stem cells and what are exosomes? Stem cells are cells that we have throughout our bodies. They are made in a lot of different areas of the body, most predominantly from our adipose tissue, our fat, as well as our bone marrow. And we have bone marrow in every bone. The best sources of it are the pelvis from the iliac crest. But we have stem cells in our brains. We have them in our skeletal muscle, pretty much anywhere you can think of. And their job is to replace tissue that gets damaged. And, we all have... not all, but most of us have some sort of chronic disease. And as we get older, things start to, quote, break down, and we need more stem cells. And unfortunately, the opposite happens. We actually have less as we get older. But stem cells are cells. I mean, they have a nucleus, they have DNA, they have chromatin, they have the whole kit and caboodle of what a cell needs, whereas exosomes are not. They are byproducts of cells. Every cell in the body makes exosomes or excretes exosomes. And so you end up seeing exosomes in all types of body fluids, saliva, urine, lung fluid, anything you can think of. But in the world of regenerative medicine, the ones that we really care about are the ones that come from stem cells. Because exosomes are truly a function of what creates them, what cell creates them. So for regenerative medicine, we really don't want the ones that are created by a lung cell, or they just don't have all of the components that are very beneficial.
So tell me more, what is the hype on exosomes? I mean, exosomes. It's all I'm hearing these days from patients, providers, everywhere. I feel like this word is really booming. Why does everybody want to get their hands on some exosomes right now?
Yeah, I mean, the hype is real. It's warranted. There's some great studies that started 20 years ago looking at not exosomes specifically, but the end result is we think that it's exosomes that created the benefits in those studies. And those were done at Stanford starting in 2005 in mice, actually. It's a funny story. They actually took mice and they spliced together their blood flow so that two mice shared the same blood flow. And what they did was they took an old mouse and they connected it to a young mouse so that they shared the same blood flow. And in the old mouse, they actually gave that mouse a skeletal muscle injury. And they wanted to see, what would happen? Would it heal well or not at all? And it was remarkable. The old mouse skeletal muscle injury healed like gangbusters when it was connected to the young mouse. And the type of experiment where you take two animals and you connect their blood flow is called parabiosis. And very quickly, they really do share a blood flow, and they kind of come to the middle. So like the old mouse, pretty much everything you can think of, their heart, their brain, everything starts to function better because they're exposed to something in the blood of the young mouse. And the young mouse actually gets physiologically older. So they meet in the middle, okay? Subsequent studies were done more at Stanford, some at Harvard. It kind of bounced back and forth. They looked at memory. The old mice that were exposed to the young blood flow did much better in like looking for the cheese. You know, they have these various experiments they do. And then they did one where they gave them a heart injury, and it healed up very nicely with the blood flow from the young mouse. In fact, the heart itself looked dramatically younger. So that is how it really started. And the question is, what is it in the blood that's creating these benefits? And the answer is most likely exosomes from the plasma. So as the years have gone on, especially the last 5 years, the usage of exosomes in humans has become much more popular. Aesthetics, systemically, there's a lot more research coming out, not just in animals, but in humans, showing how well it works for neurologic repair, kidney repair, restoration of function. It's really warranted what the hype is all about.
Well, thank you. That was a lot of information, and it, was very beneficial. I think we really got to the bottom of why exosomes are so great and why everybody wants them right now. So, my next question for you would be, I know you go into what you call the regenerative trifecta. So can you tell me, what the benefits are outside of exosomes with just the stem cells? What if I only want stem cells, or what if I only want exosomes? And, PRP, why is PRP so great with them? What if I just wanted one? Why should I get all three?
It's a good question. We have 2 labs, one here in Arizona, another one in Pakistan, and we work very closely with our sister lab in Tijuana, Mexico. And all the PhDs have been working the last 5 years on the optimal combination for patients to get improvements. Because we have people coming to us from all over the world with many different conditions. Some of them really don't have much research behind them, so unfortunately we have to turn them away, because the last thing we want to do is treat somebody with, the Christopher Columbus style, just looking for the new world. But when we've looked at what the benefits are in these, let's say, these kids that are coming to us internationally, what we found is stem cells work dramatically well for these kids. And stem cells do have exosomes in them, right? They're creating them. And when the stem cells are administered, they do release exosomes. But then years ago, we started using them together. We started using the umbilical cord stem cells plus the umbilical cord stem cell derived exosomes. And we found that the results kind of went up on a hockey stick. So not only do the kids get better quickly, but we found that they had better results that lasted longer. And we found that for autoimmune issues at our international clinics, and I could probably list about 20 other conditions that we have found over the years that they work very, very nicely together. With the third part of the trifecta, with PRP, one thing that stands out to me is back pain. Back pain comprises 25% of our patients. So it's a very high number. Back pain is so rampant. It's called an epidemic around the world. And 85% of people get it during life. And unfortunate small percentage of those, it becomes chronic. And it becomes chronic to the point of oftentimes incapacitating. Then you go in for maybe last resort, which is a spine surgery, and a lot of those fail, and you end up with failed back surgery syndrome, and then you go in for another surgery, and the results may not be, what you want there. So we get a lot of people coming to us who have failed back surgery, maybe 2 failed back surgeries. I mean, it's rough. And the last thing they want to do is live on narcotics. They don't want another surgery, or maybe they're not a candidate for another surgery. What can they do? So what we developed is a protocol that uses the regenerative trifecta with umbilical cord stem cells, exosomes, and PRP. And PRP is very straightforward. We take some of the patient's blood, just from the arm, like a lab draw, maybe 30 cc's. We spin it very, very fast in a centrifuge, and we take the middle and top part, which is the PRP. It has a lot of growth factors in it. It has platelets. It has some stem cells. So when we add that to the other two parts, the stem cells and the exosomes, it helps to activate those biologics faster, and it helps to provide a nice scaffold for new tissue repair. And we found that once again, when we combine these, the results shot up the hockey stick to where patients got better faster, and the results lasted a lot longer. So the regenerative trifecta is something that we trademarked and we developed as a proprietary combination for patients, and it's been a game changer for us.
Yeah, for sure. It sounds like it. And just, for our listeners that don't really know what PRP stands for, could you tell us what PRP stands for?
Yeah, absolutely. So PRP stands for platelet-rich plasma therapy. And once again, we just take some blood from the patient. It could be 30 cc's. It could be as much as 60 cc's if you're coming in for several joints, let's say. And then what we do, once again, is we spin it very quickly, about 4,000 RPMs in the centrifuge for maybe 7 or 8 minutes. And the bottom part is dark red. That's where most of the red blood cells go. They're heavier, so they sink to the bottom. We don't want those, so we actually discard that part. But above that, it has like a straw color to it, and that's where they call it liquid gold, because that's where the PRP is with the platelets, growth factors. There's about 10 of them. There's quite a few mesenchymal stem cells at that interface just above the red blood cells. So we've been using that with our other biologics for quite a few years. And you use PRP by itself, it can be very beneficial for hair growth, for facial rejuvenation, for sexual health, for joint pain relief. But when you add the exosomes and stem cells to it, it goes from minor league to major league, and it's truly an exceptional combination.
Yeah, definitely. Thank you for that definition. I'm sure it's really helpful for a lot of our listeners here. So I want to get into umbilical cord derived stem cells and exosomes because, a lot of people don't know the difference between the stem cells and exosomes. Obviously, you've spent some time now talking about what are stem cells and exosomes, but can you tell us why does R3 love umbilical derived stem cells and exosomes? Why are they the best?
Yeah, it's been a long journey to get to the point where we are. I started R3 over 13 years ago. We've done 26,000 stem cell procedures since then around the world in 7 countries where we have locations. And when I first started the company, our centers were doing a lot of bone marrow and adipose stem cell treatments where the patient, him or herself, was the donor. So we had to either do a mini liposuction from the belly or whatnot to get some fat. And then bone marrow we would take from the back of the pelvis. We had some patients who got some like seromas, like a non-infectious drainage, or they had chronic pain from the area of the pelvis. But irrespective of that, what we found is that as we age, a lot of the stem cells that we have age with us. So not only do you have a decrease in the numbers of stem cells as we age, the stem cells that we do have are much less active. They're more likely to, be on the proverbial couch eating potato chips and, watching Netflix as opposed to actually be up doing some sort of a function, right? So, and then about 10 years ago, amniotic fluid was found to have not only a decent amount of stem cells and growth factors and some exosomes, but we found that if we gave the amniotic fluid from, let's say Betty was the donor, and we gave some of that fluid to Tom, who's unrelated, into his knee or IV or whatever, it did not get rejected, which is fantastic. What we found that scientists call it being immunologically privileged. So amniotic fluid worked well, and it still does for a lot of people. But then about 7 or 8 years ago, researchers started to find just how many stem cells there were in umbilical cord tissue, and not just what how many stem cells there were, but just how many exosomes. And there's like over 30 different types of growth factors. So PRP has about 10. Wharton's jelly, umbilical cord tissue has like 30 different types of growth factors.
Wow, that's a huge difference for sure. And I'm sure it's clear to everybody, why we would, want to go with these. I mean, umbilical cords, stem cells, they're, highly active, brand new, young stem cells. Now, tell me this, because they're so new and they're so smart, what else can they do? Can they help, the other cells in our body by teaching them how to become more active? What are some other factors that are beneficial?
Well, the point that you just brought up is one that I didn't address previously about activity. So when you look at the proliferative activity of umbilical cord stem cells, they are so young and so naive. The activeness of those stem cells is incredible compared to, I'm in my 50s, or I think our average patient is probably in his or her 50s. The activity of our stem cells is just not much. I mean, they're pretty lazy, like I said, and there's not enough of them. So, but when it comes to the umbilical cord stem cells, there's quite a few of them in one umbilical cord, and they're super active. They when umbilical cord stem cells replicate, when they copy themselves, they do that pretty quickly. That's called doubling time, much faster than our own bone marrow or adipose stem cells. As far as the trilineage differentiation, their ability to, become other types of cells, they're much faster at that and much more powerful. The cell-to-cell communication that they provide is much more powerful. The anti-inflammatory activity that they provide is much more powerful. So you talk about every little variable that you look at, they just exceed what the ones in our own body can do, especially as we get past our 30s, 40s, into our 50s and 60s. It's just night and day, the difference that you see.
But can they retrain some of the cells that are less active in our bodies?
They can, exactly. So when you put umbilical cord stem cells into, let's say, let me pick an issue that people are dealing with. All right, let's say diabetes, okay? When a person has type 2 diabetes is the one that's acquired, right? From excess sugar or whatnot it's usually lifestyle factors. But what happens is you're not making enough insulin in the pancreas, and the body gets resistant to the insulin that you're making. Now, if the stem cells that we had in our body were very active, they would replace those cells in the pancreas to make more insulin, right? Or they would, wake them up more, but they just don't have the activity. They don't have the whatever you want to call it, the desire or the gumption to make those things happen. Or maybe we've used them up to where they just don't have that enough to take care of the problem. When we give umbilical cord stem cells to somebody who has type 2 diabetes, and we actually wrote a paper about this last year, multiple things happen. One is the stem cells that we give do not become the pancreatic beta or islet cells, right? They're not becoming part of that person's DNA, but they are creating a kind of a domino effect where the person starts to make a lot more insulin. So how does that happen? Well, exactly what you just asked is they're creating the stem cells that you have, they're kind of waking them up, giving them that, like that movie Cocoon, where the senior citizens started acting and feeling like they were in their 20s again, So it's very similar to that analogy. And it's remarkable because not only do these individuals make more insulin, but the stem cells that we give also have this cell-to-cell communication where they make the cells around the body more susceptible to the new insulin that's being created. What's the result? The blood sugars are controlled better. The secondary complications of type 2 diabetes like neuropathy, erectile dysfunction, eye retinopathy, the incidence of those goes down dramatically, all because those umbilical cord stem cells, either directly or indirectly, woke up your innate restorative mechanisms, which otherwise were failing.
Wow, that's pretty impressive, I would say. I'm convinced. I don't know about everybody else, but I'm definitely convinced. Well, do you have anything else to add today? I know I asked you, I really picked your brain today on, what are stem cells and what are exosomes? And, I've got a lot of other thoughts running through my head for our upcoming episodes that we can all look forward to. But, do you have anything else that you'd like to add or have anybody know that's really important about what are stem cells and what are exosomes?
There's so many topics that we'll be covering over the next, few seasons. There's so many topics to cover. You can't do it all in 1, 2, or even 10 podcast episodes. But one of the things I wanted to mention in this first episode is that, I think it became obvious in what I was saying that all stem cells are not created equal. There are autologous cells, which come from yourself. There's allogeneic, which is the donor, which is predominantly what we use. And one of the things that is very important for the consumer, the patient out there, is accurate educational information. There's a lot of misinformation that comes out from our competitors, because they have an agenda. And everybody has an agenda. The question is, what do you do with that agenda? Do you use it to educate properly and give people the knowledge, the power that they need of knowledge to make accurate and informed decisions about their health care? Because right now we're in a very unique time where these procedures have been shown to be effective and safe when done properly, but they're not FDA approved, right? So we're in sort of this gray zone time period where they're legal, they're being done all over the world, in the United States too, but we have to be very upfront with what they can do and what they can't do. So I think that's the part and parcel of what patients need to understand, and they need accurate information as opposed to a lot of the drivel that a lot of our competitors unfortunately disseminate.
Right. And I appreciate you bringing that up. And, for the listeners out there that don't know about our price match guarantee and our therapy commitment, I encourage you to go online and look it up. Of course, there'll be a whole episode in the future about both of those individually. But, that's what I love about R3 stem cell is that it's not about the money, right? Obviously, everybody loves making money, but deep down, our root mission at R3 Stem Cell is genuinely helping patients. We'd rather lower our prices and match the price or retreat you again for free if you didn't see any results at, one of our medical trainings. And it's because we care. It's not because we want your money. It's not because, we're trying to scheme behind your back. It's because we want to see you see results and we want to improve your quality of life. So, that's what's so amazing about working here. And, I'm excited to move forward with, all of our other episodes. And this is just the pilot. This is just the beginning. So really excited to be here with you. And, I appreciate you giving me the opportunity to be your host.
So you're not quitting tomorrow?
I don't plan on it.
Well, thanks, Samantha. Yeah, visit us online at r3stemcell.com. And I do, before we go, want to mention the R3 Heroes program. We do a lot of trainings for providers around the United States. So if you or a loved one knows a military veteran, or maybe you're a military veteran, or a first responder that could benefit, maybe a teacher as well, go to r3stemcell.com/hero and submit your information through the site. You can also call us. And it doesn't matter if you have, an injury or condition from time in service or on the job. That doesn't matter. We just want to thank you for the service that you provide to our country and communities. We've treated over 200 patients through the Heroes program to date. And it's one of the most exciting initiatives that we've started. It's so cool to see these folks get better. And they're very thankful. We're very thankful to them. So anybody you can nominate, please do so.
Thanks for bringing that up. You stole the words right out of my mouth. Awesome. Well, thank you everyone for listening, and we'll catch you next time. Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.